I welcome you to Health Pot. I believe you are having a good evening, and the fact that you can hear this voice, you can watch this image, yeah, it's an assurance that God has really kept you, and we bless Him. It's a Friday, and Edwin Austin Mukalas is my name. This is Health Pot, brought to you by Makerere University School of Public Health in partnership with Family TV. This show is basically looking at maternal health and early childhood development. Yes, these are the two aspects that we look at. And a month back, we had Dr. Hanifah Naamala Ssengendo taking us through the developmental milestones. And I believe, yeah, she exhausted the milestones. But the question now was, what are the delays? Why do these delays occur? And all those other questions. That is the reason she's here with us even today, to take us through the developmental delays now. Not the milestones, but now the delays. And I believe by the end of this show, your questions will be answered. Doctor,
Yes,
you're
please.
most welcome to today's show.
Thank you.
We are once again glad that you're here with us.
We thank God for the gift of life,
Indeed.
because many people have lost their lives.
Yeah.
Thank you very much, Edwin. Thank you, Family TV, for giving us an opportunity to discuss important issues concerning growth and development. The earlier episodes, we handled the issue of milestones,
Yeah.
the stages. So right now the issue is, so what are the delays? What happens? You told us the normal.
Yes.
So what happens? Or if it doesn't happen, so what?
We start with the definition of these delays. Why are they even called delays?
Okay. Developmental delays, like the English word actually is that
Delays.
at every stage, a child is expected to do certain things, to function in a certain way. Like we said, at 2 months, the baby is laughing. If the baby does not laugh at that time, that is a delay. So it is a dysfunction. But when we talk about generally about developmental delays, most of the time we need to understand that the delay can be in terms of movement, the way the child is moving, the way the child is talking, the way the child is even looking, like looking at the way that the child can look and recognize, the way the child reasons. So anything that is a dysfunction that differs from what the normal is a developmental delay. And relating it to early childhood development,
Yes.
we discussed earlier on that below 8 years, the brain is still growing. But maximally, below 3 years, anything that challenges the brain, below 3 years, meaning from the time the baby is in the womb, up to 3 years, that is the maximum time when, if things happen, the child can actually get a delay. And those delays or those challenges onto the brain can lead to what we call cerebral palsy. Cerebral palsy is a mixture of different dysfunctions because
Yeah, I thought it is
the
only
brain
one.
No, it is a combination of things that happen when the brain gets a dysfunction, when the brain is challenged, which challenge can happen during pregnancy. The challenge can happen at the time of birth. You remember when we talked about the golden minute?
Yes.
That if the child does not breathe within 1 minute, the brain does not get oxygen. So the brain, or a part of the brain, can actually die. It becomes dysfunctional. Okay? So, or at the time when the brain is growing, during these early childhood development days. So anything that challenges the brain, it can lead to developmental delays. It can lead to dysfunctionality, which actually comes into a wholesomeness of cerebral palsy. So cerebral palsy happens during that time that I've talked about. That's why when you were growing up, did you hear people talking about, I've gone to take medicines?
Yes.
When pregnant? In Uganda, ngenze kunywa ddagala.
Yeah.
Exactly. So
and
that
we
is
thought maybe the cup is only in the hospital, so you just go, they
go
pour
and
for
drink
you,
medicine.
and then you drink.
No. It's a wholesome where they examine you and see if there is anything that you have that can actually challenge the baby. This also includes giving you some medicines. For example, giving you medicines that boost the blood so that the brain is not challenged with the lack of blood. Giving medicines to the mother, to the pregnant mother, that can prevent malaria, because malaria can actually affect the baby who is inside the womb. Or even soon after the baby is born, if the mother did not take antimalarials for prevention, the baby can get malaria, and then that malaria can bring risk to the brain, and the baby gets these developmental delays.
Okay, we hear people say, they say it in Luganda, omusujja gw'okubwongo. Is it the cerebral palsy?
Okay, omusujja gw'okubwongo is like cerebral malaria. It is a cause of cerebral palsy. Because cerebral is the brain, a part of the brain.
Yeah.
So that part of the brain, when it gets challenged, like when it gets fever, omusujja gw'okubwongo, because like in Uganda, we have malaria. We are endemic for malaria. So when the child gets fever and that fever is not treated well, the fever can challenge the brain. It can cause brain damage, which leads to a dysfunction. And that dysfunction is depicted in the way the child achieves the milestones. So when that part of the brain that controls the movement of the muscles gets affected, that is basically cerebral palsy. So what happens is that the muscles change. The muscles either have increased the tone, I don't know what to, like they become hard or fixed, you know. Even the child cannot, for example, if you see a child who is below 6 months, if that child's neck, for example, is so stiff, that child has a problem. Remember, we talked about neck control.
Yes.
If the child's neck is so floppy, like the neck is just falling, you know?
With no control.
With no control. So that is a developmental challenge. If the child at about 6 months, if the child cannot sit and is just falling, or is sitting one side, it means the part of the brain that controls the muscles, maybe on one side, is so weak that this child cannot actually control. The child is not able to crawl normally. The muscles are either too stiff, or they are too floppy, like they are very soft, or they are not even coordinated. Because remember, we said that if a child, for example, is above 6 months, that child should be able to sit, that child should be able to try to put fingers in the mouth. Yeah. If the child has a developmental delay, you as a parent, you look at your child and the child cannot bring his hands to the mouth. Why? Because the muscles are not coordinating. Instead of holding something to put to the mouth, the child will just do this. They cannot locate because the muscles are disorganized. They cannot even sense, like, you see, when you give a baby, if you have a baby and you give that baby about 7 months a pen, something, they can be able to do fine touching, you know. They touch, meaning there is coordination that makes these fingers fold to be able to touch the pencil, the pen. So if the child cannot do this because the muscles are too stiff, you put the finger here, the muscles can't. The muscles are too stiff, or they are too floppy. You put something for the child to put on the mouth, they cannot. So it means that that child has developmental delay. The child cannot sit by 6 months. The child is not sitting. By 1 year, a child who is not crawling and standing and beginning to walk, because walking requires the muscles to coordinate and, you know, understand that now I should be moving, you know. The muscles are too stiff, they cannot, or they are too soft, too floppy, the muscles of the legs. So that means this child has that general condition called cerebral palsy.
What about stretching the legs? Because a certain mother actually was concerned and was, my baby is 1 year old, but instead of walking, they only stretch the legs. They sit and stretch the legs. Is that normal?
Yes, that is what I call the coordination. They cannot coordinate. So instead of sitting, because sitting requires for the legs to flex, to be folded. But if a child has a delay, instead of folding, they will just stretch. That the muscles are too stiff. That means the joints cannot even do what?
Cannot fold.
They cannot fold, they cannot flex. So that is abnormal. Even if it is the hands, if the child all the time has the hands crossed, then the child is abnormal.
Some
Why?
mothers think the baby is just humble.
No, it is not being humble, by the way. The baby should be able to move the hands in whatever the direction. But if you are having a baby, for example, you have a 6-month-old baby, and the hands are flexed, folded like this. I'm trying to avoid the scientific words, so you bear with me. The hands are crossed all the time, and they are stiff, you know. The child is clenching the teeth all the time, is putting the mouth together, you know. That means that child's muscles have a problem. They are too tight to do anything. So you find such children cannot even feed. You know, feeding, what it requires? Yes. It requires opening the mouth. So if the child got a problem, maybe during pregnancy, during birth, or during these early childhood development years, during these 3 years, the child got malaria, the child got a problem, and the brain, the part of the brain that controls the muscle has been affected, this child will not be able to do those things. They cannot sit, or they sit wrongly. For example, if the child is folding their legs, when this leg folds, this one should be folding. So you find a child, one leg is folding, the other one is stretching. So that is an abnormality. So that child cannot sit properly. Or if it is walking, one leg cannot walk. They try to move one leg, the other one cannot. So all those are signs of developmental delay. It even goes to speaking.
Doctor, I think at that point, let us go for a short commercial break, and then when we come back, we are going to start from the speech, because it is now becoming more serious.
Yes.
Brethren, yes, we can. We can clear the debt of church house. And I want to invite you to give generously to the love gift. May God bless you as you give.
Welcome back from the commercial break. This is Health Pot. Adrian Austin Mukalas is my name. This program is brought to you by Makerere University School of Public Health in partnership with Church of Uganda Family TV, basically looking at early childhood development and maternal health. Today we are with Dr. Hanifah Naamala Ssengendo. She's a pediatrician from the Stepping Stone platform. She's taking us through the developmental delays. And before the commercial break, just in case you've just joined in, she was telling us about now the delays in speech. Doctor, we are back. I think very many of us, or very many of our parents out there, don't take some of these things serious. And I think a few parents take time to watch
Yes.
these delays and notice them. So we are now at the speech.
Yes, yeah, at the speech, yes. Because remember, even speaking, there is a combination of muscles of the mouth
Yes.
with the tongue. So if the baby's brain was challenged, if the baby's brain got a problem, the brain did not get enough oxygen, the brain did not have enough blood, the child was born but with a lot of difficulty and the bones may be pressed to the brain, the baby can fail to speak normally. And because the part of the brain that controls the muscles has been affected, the child cannot speak, because speaking requires coordination. Like if a child sees you and is able to say daddy, that means the child has to know that this figure
Yes.
is for Edwin daddy, but why yet daddy anyway? Yet.
Ask Jonah, the producer.
Maybe Jonah, the producer, knows. You know, the child has that cognition, the understanding that this figure is for daddy, and will say daddy. And when the child sees mommy, can be able to say mama or depending on the stage. Because we said,
the face.
yes, that recognition and understanding and interpreting it to say that now I need food or I need mommy, that one gets also challenged. When that part of the brain is challenged during birth, during pregnancy, during the time of birth, or these early child days, the days when the years rather when the child is brain is still growing. So the speech requires muscle. So if the part of the brain that controls muscle has been affected, the child will not speak well.
We have
So
a
you
challenge.
find children that instead of speaking, they just say because they cannot speak. You even find them drooling saliva. Why?
Yes.
Because this mouth cannot close. The mouth cannot close. Like I told you, when the brain is challenged, when the brain has a problem, the muscle is so floppy.
Yeah.
Because for you to close your mouth, you need that control.
Yes.
So when the muscle of the mouth is floppy, the saliva just what? Drops or drooling of saliva. You find the child is just moving out to the tongue. Why? Because they cannot coordinate. The tongue thinks that it should be outside. The brain is not coordinating. Instead of saying, okay, now you are closing your mouth, let the tongue be in. The tongue is out. So this child cannot speak. It even goes to the eyes, because the eyes also have muscles.
Yeah.
The face has muscles. If the muscle, the brain has been affected, the child will not be able to open their mouth, their eyes well. Or they open wrongly. Instead of opening, they will be like maybe blinking, because the muscle thinks that all the time I should be closing. Or there are those ones who even cannot close their eyes. Can you imagine
And
that?
they take long to blink.
Yes, they just look. And you know what the problem is?
No.
You know that blinking helps to avoid foreign bodies.
Yes.
So this child, by just looking like this, the eyes will become dry. Anything can drop on the eyes, and they get eye infections. So all these things we have talked about, the causes are what we have discussed.
So, doctor, before we go there, I'm taking you back to speech. We have now a challenge, and this is now speech milestones. When should a mother now realize or sense that there is a problem with my child's speech? Because we have now children who stammer. And then they also have hardship in pronouncing words. So when should a mother now start saying, there is a problem with my child's speech?
Okay. We said by 6 weeks the child coos. Coos meaning the child is doing oh, you know. By about 3 months, the child continues to say that sound. But if you find that your child does not even produce any sound, some children may even fail to cry because why? Crying requires still a mixture of muscles and whatever. Okay? A child usually starts crying when they are discomfortable. For example, even at 2-3 months, if the diaper is full or if they are feeling so hot, they can start crying and you say, oh, maybe the child is hungry. So by about 5 months, 6 months, if you notice a child who is not controlling their tongue, a child who does not have any speech, like maybe da 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 da, they cannot say da da da, ta 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 ta, you know, by about 6 months, then there could be a problem, you know. But you have to start early by watching different things, because I told you these developmental delays, or what we can call cerebral palsy in a consortium, it is a combination of several symptoms. Because if a child does all the other things and the problem is speech, probably that is a different problem. It can be familial. Like we have families that take long to speak. That is, it runs in families. It is their DNA. For example, they stammer. Even a child who stammers begins to speak. But when time comes for coherent speaking, like speaking continuously, then you can see the child is stammering. But they will start to speak, you know. So even if a family stammers, but the child is supposed to speak, at least can say mama or ma, then you can know that maybe it's not adding mama because of the stammering that runs in the family. But I told you the ma comes out. But I told you it is a combination of other muscle things. The walking, the crying, neck control, you know. And both of them are either side. Either the neck is falling or the neck is too stiff. Like you hold a child and the child is like sort of going away from you, pushing away from you, you know, because the muscle is toned so much, pushing away from you. All those are signs and symptoms and the causes of such developmental delays.
Now, of course, you've told us signs and symptoms, but now, I don't know whether the time we have now can be enough for us to discuss the causes in details, but maybe for today's show, you give us your last remark, and then we shall, in the next show, we shall talk about these in details.
I think my remark is that as parents, let's use our God-given role, that is parenting. Because these things require you to observe. You can't say that I'm a very busy working mother. I cannot go for antenatal. Antenatal, there is a big line. That big line is better than you having a child who will get developmental delays. Because some of this challenge, this risk to the brain is irreversible. It will be there forever. So for you saying I'm feeling weak, I don't want to go to lines, I don't have money, what, utilize what you can so that you avoid such things, whereas you would have avoided them by just going for antenatal, by being very observant. Thank you very much.
We are grateful, Doctor, and we are still with Dr. Hanifah because we still need her. She has a lot to tell us. But as for today, allow us end here. Edwin Austin Mukalazi is my name. I've worked with Jonah Jao, the producer, Tony Sant on social media, Brenda Tijakira, the associate producer, Bantam in transmission. God bless you. Until we meet next time.